right, I think it's setting itself up. And great. All right, great. I think we're live. Hi everybody. Those of you who are stumbling on this page, my name is Steve Owens. I am a candidate for state representative in the 29th Middlesex District, which covers parts of Watertown and Cambridge. I am doing these virtual town halls. This is our third one. 2 weeks ago, we had a discussion with Eric Schupin of CHAPA on housing. Last week, we had a discussion with Liz Goss on immigration. And today, we are lucky to have someone who is in very high demand lately, Representative Dr. Jon Santiago. Representative Santiago is an ER doctor at Boston Medical Center. He is really the person in the right place at the right time, if there ever was one. Somebody at the intersection of government and healthcare during our pandemic times. So so welcome, John. Welcome. Thank you so much for joining us this morning. I guess it's still morning now.
Thanks for having me, Steve. And good to be with so many friends and familiar faces on the phone call. And for those hearing in on social media, Steve, you've been a friend of mine long before I was in office, long before you were running for office. And I still recall when you were running for Democratic State Committee seat, and you come to our ward in the South End. And I think from the get-go, I said, listen, we have to really support this guy. He not only talks the talk, but he walks the walk. He's effective. He works hard. And I anticipate you'll be doing the same thing when you roll into the State House come January 1st, 2nd, or 3rd, whenever we swear in. But we saw the campaign, to not to launch, but to move forward and get you in there. So I'm happy to support you, to endorse you, and to talk about these important issues. As you said, we are in very difficult times. I mean, I don't want to say that we're in unprecedented times. I feel like everyone is saying that nowadays. But given the fact that COVID-19 has completely disrupted so many parts of our lives and has laid just so much morbidity and mortality onto, we're talking about 114,000 people have died across the country. I saw a new estimate yesterday that said by October, 200,000 people
Wow.
potentially have died across this country. And
yeah,
and we're in a hotspot here in Massachusetts, right? I think, we've had over 100,000 cases. I think we're up to 7,500 deaths, and the end is nowhere in sight.
So that's what I'd like to talk about, because we're in a, we're going through the second phase of reopening, the second and a half phase of reopening. It's hard to kind of keep track of what stage we're in. Emerson is reminding me, if you're on the call or on the Facebook and have some questions, you can just type them in the chat on Zoom or in the Facebook comments, and we'll try to get to them. But again, yeah, thank you, John, for coming out here. Yeah, and but so we're starting to reopen. Your experience in the ER, does that match what we are our progress that we seem to be seeing? That the numbers bear out what you're seeing on the ground?
Yeah, so that's a great point. So as you kind of alluded to, I wear two different hats in this. I'm a legislator, and even within the legislature, I've been honored to be a part of this COVID-19 task force. So I've been very involved in this issue at the legislative level, and a part of a number of the bills that we put forth, whether it's the voting bill, whether it's the data bill, but I'm also still wearing my ER hat. And pre-COVID, I've been working every other weekend, Friday, Saturday, and Sunday. And given the need for more doctors and more human resource capacity, I've essentially been working every Friday, Saturday, Sunday for the past several months. And it's been, from the beginning where no one knew what the hell was going on. You walk in there, people were sick, people were coughing, there were no protocols or procedures in place. I mean, literally, I was coming to a shift and I worked the overnight shift, and literally everything was on the fly. But over the course of a couple of weeks, we've been able to put together policies at the hospital level to really address what's going on. And we hit a significant surge third week of April. And now we are on the decline. We are on a plateau that seems to be never ending. But if you look at all the numbers, we are headed in the right direction. We're looking at a 7-day positive rate of about 3.3%, which is the lowest it's been forever. I think we're at about 1,100 hospitalizations. In terms of hospitals that are continuing to use surge capacity, that's down to 4. So I think things are all heading in the right direction. The problem with this is that, borders are porous, right?
Right.
So no matter how good we're doing here, and this is a hotspot, mind you, it just takes a couple people flying in from Arizona, Texas, Florida, to come in here and to completely upend all that.
So I was looking at that, and there was the story today or yesterday that Texas had 4 days in a row or 5 days in a row of record hospitalizations.
Yeah.
And we're seeing the same things in Arizona and Florida, like you mentioned. And I mean, we can't forget that a lot of what happened in Massachusetts was the result of one or two big conventions where if we look at what happened in Biogen and how many how things spread out from that one convention on Long Wharf all those months ago.
But it's important to say, Steve, real quick, just not to interrupt you, but it's not just about Florida, Arizona, Texas. I mean, it's about Chelsea, Brockton, Lawrence, right? Even within the state and the Commonwealth of Massachusetts, we still have very active hotspots. And if you just look at the globe, I think covered Chelsea again the last couple of days, and just the number of positive, the high number of positive tests there, it's still a hotspot. And again, those people don't have to take a plane from Texas to come to Boston or go to Watertown. It's just a short drive over there. And so, we're still in the thick of it here.
So let's talk a little bit about those hotspots. So are we seeing, is the change in the numbers, are we seeing it focused in those areas, or are we seeing kind of, they're still the hospitalization rates and the number of cases are still, either staying flat or, not getting better in those areas, whereas the rest of the state is kind of slowing down a little bit? I've noticed that out in the western part of the state, the numbers seem to be going in a different direction compared to Middlesex and Suffolk counties.
My guess is that there's been an overall decline, as the numbers would suggest, but the decline in the hotspots hasn't been to the level of decline in other parts of the Commonwealth for sure. And so we still need to be particularly vigilant when it comes to hotspot communities, and I'm referring to primarily communities of color, poor communities. And I think about Boston, for instance, the need to expand testing and care and treatment in communities of color. Just this week, I think Thursday and Friday, we're going to have testing, additional testing. I'm sure you've probably heard the governor's announced 50 plus sites to do testing, given the fact that we just had these protests and demonstrations, which could be super spreader events, right? Like the Biogen conference was. And so we need to be, in lieu of a vaccine right now, all we have are really two tools, testing and contact tracing. And so it's very difficult to get a handle on the virus to control it if we're not doing those at the levels that we need to do. And when it comes to testing, per capita testing, we're among the leaders across the country. But if anyone's looked at the data over the past couple of weeks, we were going up, and over the past couple of weeks, we've averaged about 8,000 tests. And I thought people would be, it's unclear exactly why. I'm curious to know why the numbers have gone down. Is it a lack of testing? Is it a lack of demand? People just not coming to get tests?
Well, do you think it's that people have decided now that they're not going to pay attention anymore? I mean, when you go outside, you see people are ready for summer. Most around here, I've noticed most people are wearing, they're wearing masks, at least when they're around other people. Maybe not, when they're, able to be a little bit more distant from each other. But in terms of, the vigils and other events that I've gone to, just about everybody is mostly masked up, except for when they're not, except for when the mask is here or here, or I've seen a lot of the nose out with the. So I'm wondering if the signals that have been sent that we're opening have kind of told people, well, you don't need to take this seriously anymore.
I think it has, though. I think, and again, I haven't seen any polling, but anecdotally, I was still leaving my wife's been really good at staying home for like months straight. But but I've had to leave to go to the hospital, and I still do a jog in the morning. I wear a mask. But even over the past 2 weeks, I've seen anecdotally, of course, I'm a scientist, physician, I believe in data, whatever. But I see people just walking around without a mask now, much more often. I actually went out to at some outdoor restaurant for the first time in several months, and just the number of people, and I was commenting to my wife, that I would see without a mask on, was pretty surprised by it.
Mm-hmm. And you mentioned before that the other tool that we have besides testing is contact tracing. Can you talk a little bit about how that effort is going? Has that been effective? And is there a risk that as we open out, as people spend more time with friends and family and going places like restaurants, is there a risk that it'll be more difficult? It'll make that effort more difficult?
Well, it does make it more difficult. I think the idea is that you want to trace the contacts, right? It's within the name. So if Steve Owens is diagnosed with COVID-19, a phone call will be made to him. He theoretically would be able to trace his contacts. I was in these locations interacting with these people, and those people would receive a call. And I think the plan is to speak to people within 2 degrees of separation. But I think that's proven to be much more difficult than it was anticipated. And because it's a tough thing to do, right? It's like, where were you at? Who did you interact with? What does, the idea that, if you walk by somebody, or if you have a conversation for 1 minute, or if you kiss somebody, I mean, what level of contact requires, would lead to some sort of transmission of disease, I think when I think about, as a physician, when I say, when people ask me all the time, well, I walk by this person, should I be scared? I would say typically 15 minutes. I think that's what the agreed definition is. 15 minutes of close communication with someone within 6 feet could put you at risk for disease transmission and becoming infected. But contact tracing overall, I can't recall. I heard a presentation from the Secretary of Health and Human Services a couple of weeks ago, and I can't recall the numbers, but I think it's been somewhat of a challenge to scale up given the languages involved, contacting people, phone numbers, no one's picking up the phone call. So there was, just like anything else, any other program, in the private or public sector, there are significant challenges. I think it's scaled up significantly over the past couple of weeks. And I think it's become more culturally competent and that sort of thing. But I mean, those are really the only 2 things we have, in lieu of developing some sort of herd immunity via vaccine, which we don't have, right? Which we, at the earliest, will be probably, early 2021. Just to give you some context, I think the fastest we've come up with a vaccine, I think, was measles, and it took 4 years, or so, the most recent vaccine for measles, I think. And we're talking about getting this done in less than a year. I'm not saying it's not impossible, but given that all of the energy and resources are being put into this, I'm optimistic, and we have some good candidates in the pipeline. But it's going to be not just in creating a vaccine, but the testing and the different phases and the supply chains that have to put forth in order to get this herd immunity. Is going to be challenging.
Yeah, but so let's say that we are able to get one in 4 years. I don't know if the public can handle 4 years of this, but in terms of if we end up seeing a second wave, what would we know? What would that look like? How would we be able to see that at the outset? I feel like a lot of what we learned in the beginning of this, we were told, oh, you don't need to wear a mask, save the masks for first responders and essential workers, right? So don't wear a mask, it's not going to work. And now we're learning, oh, just put something over your face, anything, because it will stop you if you're asymptomatic. Is there anything that we can, just as the general public, if you could say, like, what can we do to, either stop a second wave or, be on the lookout for when these things start, if there is another.
Yeah, so I think nationally speaking, we are in a second wave. So I would say that we are in a second wave, and it's not too surprising when these pandemics come. If you look what happened 100 years ago, the 1918 pandemic, the second wave was significantly the worst one, included the most deaths, and it was dangerous for a whole host of reasons. And there are a number of theories as to why it was worse than the first wave. Many would argue that we're in a second wave nationally. Obviously, in Massachusetts, the numbers are pointing in the right direction, so we're still good here. The question is, what's it going to look like in the following 2 to 3 weeks from now, right? Given the reopening of the economy, given the fact that people are out summertime, maybe not as vigilant as they were a couple of months ago, given the fact that we've had these large-scale demonstrations and people interacting, that's going to be the real test. And so if we're able to kind of keep these numbers in that and heading in the right direction, within 2 or 3 weeks, we'll have an idea whether we're hitting the second wave or not. I think, it's my opinion, that we will have a second peak here. I think a lot of scientists and public health experts would feel this similarly. The question is, how big will that peak be? Will it be a blip, or will it be a peak where we're talking about, are we reaching surge capacity? In lieu of reaching that space or that time and space, we need to keep on being incredibly vigilant, and so we as individual people, we need to be wearing masks. We need to be practicing social distancing when we can. And this might be the new normal. Do I think we're at a place, if we do hit a peak of some sort, are we ready as a society, as a community, as a government to really lock down everything again? I'm not sure the political will is going to be there to do that. Mm-hmm. And so we might just be reaching to getting into this new normal. When I went out to dinner with my wife Sunday, again, my first dinner in an outdoor seating place, I mean, the experience was so different. I mean, the server rarely interacted with us. It was all done online. You order. How
do you mean? So you had a little app that
you use your phone. Yeah, you use your phone.
Yeah, okay.
You took a picture of a QRS. There was a menu that would show up, and you would order here, and then they would just bring you food, and the server bringing you food would leave plates, and he would not be allowed to, or she would not be allowed to pick up plates, and there was a busing person who would do that, and so it was very different. And obviously it was outdoor, and they had masks on, and this might be the new normal that we might be in for a long time, until we, because I think, let's say in the next 2 or 3 weeks we start to see a peak in case, not a peak, but rather a significant rise in cases. Are we going to go back to lockdown phase? I'm not so sure the political will, or people want to see that again, although it might be necessary.
What do you think a new normal? What do you think the new normal for is it? It might be too early to tell about this, but the guidance for childcare facilities has just come out, and the schools are starting to wrestle with two competing problems. One, they're losing a lot of revenue. Nobody's got meals tax for months. The revenue for local aid is uncertain at best at this point. So the schools, municipalities are dealing with schools maybe having less money, to requirements that fewer kids per classroom to prevent infections, more supplies so that there isn't as much sharing of supplies. Do you have any thoughts on how the state can support those areas? Because those are going to be, I know my 2 kids have been in the house with us as we're trying to work from home, it's very difficult for us, and we've got enough space in our house and enough computers for everybody, but a lot of people don't have that sort of thing. Rely on these.
You bring up a great point, like what theoretically what's possible and what's practically possible, right? I think there's a significant disconnect between the two. So you're exactly right when it came to early childcare education. What the standards that came out, there was a lot of pushback. I think there was a petition where I want to say like 25,000 people signed in protest of it, and then like within another 24 hours it was up to 36,000. So this is actually an issue I've been looking at. There's actually a small working group in the House of Representatives that I'm a part of, looking at these standards, and and I'm reading, it's about 40 pages of standards, and I don't have any children, I don't participate in these kind of daycares and these early education centers, but it doesn't seem very practical, and I think that was all the pushback. It's like, you want to really decrease or change the ratio with respect to instructors and children. It's not, the financial models or the fiscal models in place are not feasible. And so how do we do that? And, the idea that this virus is so insidious, right? And so there's a lot of, it should give people a false sense of security when, let's say, you just ask someone like, do you have a fever or have you been in contact with someone? That doesn't necessarily going to, it's going to answer all the questions. I mean, we know that so many people are asymptomatic when they have the virus, particularly children, right? So these kids could theoretically be passing around the virus to themselves, go home, infect mom and dad, infect grandma, grandpa, and and despite even answering the question that the kid had no fever. And so these are very challenging things. What we do know is that it's been somewhat of an interesting thing for the legislature and I think government to look at these institutions, whether it's daycares or whether it's schools or whether it's the healthcare system, to realize that maybe things weren't working in the first place, right? Like, maybe pre-COVID-19, like things weren't even good to begin with, right? And so how can we use this as an opportunity, despite the crisis, to really move forward on some of these things, whether that's changing, financial models, whether that's being innovative. I think about medicine, right? I mean, we've had this debate about telehealth for like decades. And now we've been forced into this situation, right? I think about substance use disorder, the fact that you have to pick up your methadone every day. And within like a couple of weeks, we changed it to now we'll give you methadone for a week, right? In order to limit your, being in big groups. And so I think now, if there was ever a call for the legislature and for the governor to be innovative, to think creatively, I think now is the time.
So that's great. Caroline had a question about the phased opening. If you thought that, especially since it takes so long to find out for the symptoms to show up, if they ever do, she wants to know if you think that the phased opening was appropriate, or if it happened too fast, or maybe too early, or
no, that's an excellent point.
If you had any thoughts on that?
No, she brings up an excellent point. I think this is one of the critiques with these kind of phased opening. With if it takes a couple of weeks or at least 10 days to show symptoms of a virus, we're opening these things without addressing the lag time. If you look at the 6 metrics that were used to really kind of look at the opening, I mean, so many of these metrics were like, happens 2, 3, 4, 5 weeks after the fact, right? And so, if you're using these metrics like hospitalizations, deaths that take weeks, to occur, I mean, this virus, doesn't see any boundaries or limits, right? They just see opportunity. And so, you're like, you're operating in a place that you're flying blind for one, and you're opening things too quickly as the virus is potentially spreading. I mean, I think many experts would have said, don't even consider reopening until the positive test rate was under 5%. And we opened up, I think, when it was like 9 or 10% still. I mean, we're lower than that again, but what's going to happen 2 to 3 weeks from now, we don't know. My hope is that we continue to trend in the right direction, but I just don't know. And I guess, and me being an ER doctor, I think, we typically, in worst case scenario, when you come to the emergency room, I'm not thinking like, if Steve Owens comes in with chest pain, does he have some indigestion? Probably, he's a young guy, but I'm thinking always worst case scenario. So why operate from that kind of, like, does he have a heart attack? Is he having an aortic dissection? And then I work from that kind of assumption. And I think in this case, given that things are so tenuous and we want to prevent from, having to close everything down again, I think I would have reacted more conservatively from the very beginning. Quicker to close schools, quicker to do X, Y, and Z. And I think all the studies would show that even if you would have closed things up a week earlier, you would have saved thousands of lives.
Yeah, and I noticed myself that seemed that the governor was pushed to make those decisions by the local school districts, because we closed here in Watertown, and I think Cambridge as well before the governor made his decision. We closed. Basically, it was stunning how fast everything happened around here. The weekend, people were still going out and meeting each other, and then slowly the numbers started to come out, and then the schools just said, nope. Well, we'll make a decision on. They said we'll make a decision on Monday when we meet. And then, like, no, we're just going to close. And so that Friday, everything was out.
You bring up an interesting point. I would say in the emergency room, when a sick trauma patient comes in, and I respect the governor a lot, because I think he focuses on data, I mean, this is vis-a-vis who we have in the White House, who just, I don't even believe this.
Well, anybody would look better than
Yeah.
that. So,
But, our governors, he always talks about let's be data driven, and I appreciate that. But sometimes you just don't have all the data, and you can't wait for the data. And if you're going to act, you might as well act more conservatively. So I often tell when I'm teaching some of the younger doctors in the emergency room, like when a sick patient comes in who is like, with, a potential death, just, within minutes or within hours, if you don't act, you just have to think more conservatively, and you have to move in that direction. You can always, go the other way, you know what I mean? But like once, if you miss an important crucial step, or if something happens, there often once Pandora's box is open, it's hard to kind of get it back in. And that's why it's so important when you have these pandemics, or when you have an emergency setting, and you don't have the data, that you act and you be bold, and and you might frustrate and anger a lot of people, but once Pandora's box is open, it's open.
Yeah, I got a couple more questions about your experience in the ER, just because
Sure.
one thing that my brother-in-law is also an ER doctor in Queens, and one of the things that he pointed out to me was just how quickly the ER became a little bit of COVID and everything else to everything COVID, and all the other things that people would come to the ER for kind of didn't disappear, but mostly disappeared.
Yeah.
Have you seen, as the number of hospitalizations decrease, has that fill-in come back of people who just have other ailments that would require hospitalization via the ER or otherwise?
Yeah, that's a great point. I think what I was kind of surprised to see, and I think this was the case for most people around the country. So I work at the busiest emergency room in New England. It's like the safety net center. It's we primarily treat a lot of poor folks on mass health, a lot of people from minority communities. It is a fast-paced, busy, what people would call like a knife and gun club, right? So if you're shot, I'm going to see you, or someone's going to see, or one of my colleagues are going to see you, and it's a difficult place to work in, pre-COVID, right? It's fast-paced, and what I saw during COVID is that the emergency department became less full, right? So people weren't coming in as much. It looks like our volume actually decreased by almost half, right? That doesn't make the job any easier, but it decreased significantly for a whole host of reasons, right? So people were scared to get COVID, so people stopped coming in, right? But you're absolutely right. The ER and the whole hospital became essentially a COVID hospital. I was just looking at numbers today. We have about 20, 30 COVID patients in the hospital, but at the height we had over 200, right? I mean, the whole hospital was COVID. Now, given the fact that the ER volume went down, doesn't necessarily mean the job was any easier, given the PPE requirements, given the fact that these patients were very sick, and the job almost became even more difficult, right? But at the same time, people still have emergencies, heart attacks, strokes, gun violence, that all still happens, right? So these people are still coming in, and it's so funny. You'll have a big car accident, right? Roll over, and everyone goes to the trauma room because someone's very sick, and the guy's like a 34-year-old guy, and you're not dressed up in PPE, guy, because he comes in with like a motor vehicle accident. Next thing you know, he's tested because everyone's tested, and he has COVID, and you're thinking to yourself, well, I didn't come in with PPE. Now I'm infected. Now we're all infected, right? And so we really have to change our the way we think about COVID, and we just presume that everyone kind of has it when they're in the emergency room. But over the course of the past couple of weeks, we've seen the ER, the same cast of characters and the same folks coming in for the typical things, strokes and that sort of thing. And we've seen a lot of people who had decided who did not come in over the past couple of weeks, or not see their doctor, that come in, their diabetes is more in control. They've, now they have a complication from it. They had a stroke maybe a week ago, and that now we can't do anything about it because we didn't catch it within the first 4 hours. And so, and we're still seeing COVID. I mean, I've taken care of some very sick COVID patients just this past week who came in, one person came in with a significant stroke. They were found to have COVID. Now, I don't know if the COVID caused the stroke. We do know that COVID results in some sort of, increased factor risk for stroke. But we're still seeing COVID patients, the same folks coming back in. It's also summertime. So that means trauma, gun violence, stabbings, those are all picking up. So it's back to being this, crazy, intense environment. still with this added COVID, concern.
How are you guys doing on PPE in the early days? I know there was many shortages. There was, reusing. There was,
Still is.
a lot of, yeah. Okay.
So I think, it's important to frame the discussion around PPE around who's talking about it, right? And so
Right.
I work at a big academic center. It's a level 1 trauma center. So I never felt like, PPE was, let's say, an issue for me. I felt like not that it was, so much PPE and take all what you can get. I was still restricted to one N95 mask a shift, but in terms of gowns. But this is coming from, relatively speaking, a better resourced, big hospital.
Yeah.
But, when we think about the community health centers, when we think about the nursing homes, I mean, over half, I think it's up to 60% of the deaths from COVID-19 are from nursing homes. Were they prepared for this? Do they have the PPE? My guess is that they're still having significant issues when it comes to the supply chain. And so, we're still reusing masks at BMC. So I would say PPE is still an issue at every hospital, in every geographic region, but particularly in those lower resource kind of institutions, community health centers, nursing homes. And I think when you talk about reopening the economy, like, are these restaurants, small businesses, who's going to supply their masks? Are their colleagues and staff workers, are they going to feel comfortable talking and working with customers without PPE? I don't know. I guess not.
Well, we'll find out, I guess, in 2 weeks whether they whether this is going to be a problem or so. I did want to talk a little. So you brought up back early. You brought out the hot spots that we're still experiencing in Massachusetts. And there was a study done, I think it was MIT, that controlled for income, it controlled for health, whether you have health insurance, it controlled for a number of pre-existing conditions, and still found that minority people who got COVID, Black, Latino, had worse health outcomes, even controlling for all those other things. And some of the research around that and the thinking around that was, well, yeah, maybe they have health insurance, but it's bad. It's a health insurance you can't use, right? High deductible, no primary care physician, that sort of thing. Or maybe it's the environment, in terms of environmental justice. I mean, I don't have to tell you what's going on in Chelsea. I think they've got the cars and everything. They've got all of the infrastructure for fossil fuels, the tanks, putting particulate into the air and things like that. What do you think a response to COVID that kind of takes those things seriously, a holistic response, a social justice response to COVID would look like from the state?
Well, I think, you bring up an excellent point. I think the study, it's MIT or Harvard, and I remember reading it. And this is no surprise to a lot of us who work in this field already. I think what I've often said is that COVID-19 is not just, exposed what a lot of us already knew, but it's really exacerbated it. And I think if you think about, I work in the emergency room, and so I work on the very acute side of things, and I love my job because it's exciting and it's fun. But in my heart of hearts, I'm a public health guy. And I think, my experience is that so much of health is determined way before someone enters the hospital, right? I think if you look at, what the data says, the social determinants of health make up 80% of the health outcomes, right? So it's not, no one cares, whether you have insurance, how good your doctor is. 80% of the stuff that, the health outcomes, it's already predetermined from like the social determinants of health, how poor you are, your access to education, clean water, pollution in your community. And so when COVID-19 hit, we knew that communities of color were going to hit very hard. If you would have told me when COVID would have happened, as an emergency room doctor who works at a place that treats poor Black and brown folks, who represents a district that is diverse, that contains maybe some of the biggest disparity across the whole Commonwealth. In my district alone, from one end to the other, there's a life expectancy difference from 20 to 30 years. And I live in a very dense district in the middle of Boston, right? We have some of the richest parts of Boston Copley Square, 1 Dalton, Prudential, the John Hancock Tower. And then when you walk just a couple miles southwest, and you have some of the poorest parts in Boston, and if not the whole state, right? And so it's that disparity that we see, that I see in that district, that I see in my hospital, that we're really speaking about. So I think if we want to address COVID-19, there's a whole host of solutions you can do, from the short term to the middle and to the long term. I think right now we've been in an emergency kind of mode, right? How do we address some of the short term stuff? But we really need to be thinking long term, right? We really need to be thinking about what we can do to really address health issues in these poor communities. And I think that's what a lot of us have been fighting for a long time, like addressing these social determinants of health. Do these people have proper housing? Do they have access to education? And so when I joined the legislature, and I've only been in for less than 2 years, those are things we wanted to fight for, right? Better access to schools. That's why I was so happy to support the Student Opportunity Act, right? Transportation, the House passed this bill with respect to transportation revenue, and an $18 billion bonding bill to get the MBTA back to a more fiscal point. So there are a whole host of things we can do. And I want to think about something that's even more critical at this point is, what are we doing about systemic racism, structural racism, and the fact that, we've had COVID-19 for the past couple of months, but over the past couple of weeks, the murder of George Floyd has created this pivotal moment that we need to act, right? And it's important to note, and I would argue that both things are inextricably linked, right? And I think, it's almost like poetry. I mean, the fact that George Floyd was found to have evidence of coronavirus infection. I mean, the reason why people are protesting here is not just to, respond to and reflect on the legacy of George Floyd or Garner or Breonna Taylor and these folks. I mean, people are upset with the system that has created this, right? And it's the same system that has resulted in a disproportionate impact of communities of colors getting affected by COVID-19. So they're very related, right? It's just the way that systemic racism and structural racism kind of present themselves. So we need to be attacking these things. There's the very acute things, and I think about some of the stuff that we're working on as legislators of color.
I wanted to ask you about that, because I know the Massachusetts Black and Latino Legislative Caucus put out your 10-point plan that covered federal, state, and municipal actions that you want to see taken. And I think I want to thank you for putting all the work into that. And if you had any thoughts about how going forward we can do at least something. Is that what I would hate to see is all this momentum around and this attention to structural racism turn out to be like so many things, something that happens and everybody's interested, and then eventually people get bored and move to another thing, right? It feels like, and just going out to vigils, going out to on the street, it seems like there's a reaction now that's more positive to anything that I've really been a part of. So I think there's an appetite to do something. I think there's going to be a lot of disagreement as to what that something might be. I think, stopping racism, of course, everybody's going to be happy with that. But when you,
but what does it mean though? It's like
exactly.
Like,
That's once you get down to, well, now I actually have to change something about my life, or, I have to think critically about institutions that I otherwise trust. I think then you're gonna get some pushback. But I'd love to hear your thoughts about what the Black and Latino caucus is.
So you bring up an excellent point. I think when we had these discussions among the caucus, among municipal leaders and federal leaders, particularly our Congresswoman Ayanna Presley, I think the plan was to be very constructive, solutions oriented, right? So that's when this whole let's not just have a press conference and say like we are mad and angry and of the injustice that we're seeing, but we want to do something about it, right? And let's point to something that can create, that's a framework that we can move on legislatively. And so that's what this 10-point plan came about. And I think there are 3 or 4 with respect to what's going on at the state level and where we as state legislators can play a role in. And I think, we've had meetings. Actually, we were on, had a meeting with the governor today. We had one last week. We've had meetings with Senate President this week, Speaker of the House last week. And I think you're right. right now feels like there's a pivotal moment and to act right now. It feels a bit different. And so we really have to move quickly, take advantage of the situation, and try to get something done before July 31st when session ends. And I think if you saw what the speaker and Chairman Carlos Gonzalez said in a statement last week, we are very much committed to doing something, right? Acutely to address what's going on with respect to policing in communities of colors. And so I think there are three things. Again, look at the short term, middle, and long term. But the short term stuff is, how do we set up a system for accountability and certification? I mean, Massachusetts, I think, is one of only 5 states in the country that doesn't have a system for how do you certify and decertify police. And again, there's 45 different states. They do it all differently. Some have teeth, some don't have teeth. And so right now, we're working on a piece to get that out there. How do you make sure that things like chokeholds don't happen? So I think there's a big interest in doing something. So we are steadfastly working with legislative leaders, groups to get something done by July 30th, like signed by the governor by July 31st, which is only in 45 days. So it's got to move super quick, despite the fact that there's a COVID-19 pandemic, despite the fact that we can't meet as a legislature and that we have all these other issues. Remember, there's a transportation issue that was
Right.
that we were dealing with before this. There's important healthcare bills. There's a budget that hasn't been made yet. And so we are very difficult times, but I think that there's the political will to get this done. And when the Speaker of the House says in a statement that he wants to get this done before July 31st, I'm confident that there's a political will to get it done.
Yeah, you guys certainly have a lot on your plate. I know there was how have the remote meetings and things been going? That's something that just started up last month, and I'm curious as to how that actually is working for you folks.
Yeah, it's funny, so I'm on this COVID-19 task force. It's like 5 of us, I think.
Yeah.
We were tasked with how do you keep the House running, and there were two leaders on that group, Representative Driscoll and Representative Kate Hogan, who took the lead on designing the system. And it's kind of crazy, right? I mean, the oldest continuously used constitution in the whole world. And now we moved to this remote voting system. I think it's worked well. I mean, of course, there've been a couple hiccups here and there, but we've been able to pass. We've met in formal session a number of times. And some of the stuff was easier to pass. It wasn't too controversial. Probably the not more controversial, but just more detailed and more expansive argument that bill that we had was probably the voting bill.
That's still in the Senate right now, right?
Today, I think it's the Senate's going to pass their own bill right now, and so I'm optimistic we're going to get that done soon because I mean, again, ballots at least in the House.
Time's running out on that one. There's definitely a deadline on the voting bill.
Exactly. So July 15th was the plan to send out I was I gained an interest in that because I mean a lot of us have had an interest in how democracy works and our duty to vote, but I think me as a person of color and as someone who's seeing what COVID-19 does to communities and the fear that it instills in people, wanted to get something done. So actually, I actually wrote a bill with Representative Roy and was happy that 3 of the major points of the bill were adopted into the final bill. It's not a perfect bill. I mean, no bill is perfect, but I think it's a great place to start. I think we're pretty proud of the bill. I'm hoping the Senate passes a bill today.
Yeah, and then the assumption is that there will be slight differences that will have to be worked out. Is that the working theory right now? Yeah,
exactly. Yeah, so it might we'll see what the Senate puts out, but hopefully it's it's another comprehensive, robust bill, and that both leaders and leadership in the Senate and the House will come to an agreement, and so what they can do so they can send it to the governor as soon as possible.
Right. And is there so the session is ending July 31st, so you've only got transportation and COVID and climate and education and a budget, so is there any talk of extending that if things are not going to plan? Because I know just from my personal life, working everything through conference calls as opposed to everything seems to take a factor of 2 at least. If you're lucky in terms of getting things done.
Yeah, I wouldn't be surprised if folks are still meeting out in fall as well. You
Hmm.
know, that session, they're very well likely to be a break, obviously, after July 31st, but if
Yeah.
folks are not, are convening again before the holidays.
All right. Yeah, Caroline, of course, interested in decarceration. Since we've seen that um, a lot of the hotspots are also not just the communities of color, but also nursing homes and prisons
Yeah.
and places where you can't where people are grouped together
Hmm.
and can't socially distance
Yeah.
effectively.
Yeah. So
Um,
this is something that, Rachel Rollins and I've been, we've actually wrote a couple of things, not just letters, and we actually wrote an op-ed about this as well, and have been on the media about this. You're absolutely right. These are hot spots as well. I just included a link in your chat. It's one of the resources that I use. I don't know, Caroline, have you seen that? Have you seen that before? You probably wrote that link or something. Uh, but it's actually really interesting. It really covers the number of people that have been released and the number of tests positive, number of people have been tested, the number of positive tests among staff and prisoners. And it looks, we've released, I want to say, over 1,000 people, according to this. It's pretty much, I would highly recommend people check it out. It's called Tracking COVID-19 in Massachusetts Prison and Jail. And it has data by facility. It compares testing rates and aggregate totals. So it's very interesting. But you're absolutely right. Yeah, Carolyn, you should definitely take a look at that. It's pretty fascinating.
All right, so we are pushing out on our 45 minutes, but so if there's any other questions from the chat, I don't think anything came in via Facebook. No, I don't think so. But is there anything else that you're working on that you think has a chance of getting out the door either this year or if in sometime in the medium term?
Yeah, no, I think so much of the efforts have been put in how do we address the acute issue right now, which is
Hmm.
COVID-19. But now it's COVID-19 plus how do we address these issues of systemic racism and policing? And I think, whether it's the restaurant relief bill, the vote by mail bill, the eviction moratorium, I think the government has responded appropriately. But make no mistake, I mean, we're talking about a $6 billion hole in revenue.
Yeah.
Just to give you some context, during the 2008 recession, I think it was about 2 billion, right? Unemployment peaked at 8.8% in 2008. I mean, here we are 15, it's going to be probably higher than that. And so there are so many unanswered questions moving forward. And I think we're just going to need, all hands on deck here, right? And I'm hopeful that we as a legislature can be as responsive as possible when it comes to the acute needs of the day. And I'm optimistic that, we are going to be in some tough times in the remaining weeks, months that follow, if not years, but that we're going to bounce back stronger. And I think, and I'm looking forward to working with, folks on this phone call. I mean, Carolina, I see her in the State House all the time, and she's been a great advocate on a whole host of issues. And hopefully, Steve, people like you, once you're in the building, to work on these important issues and to really build coalitions in the building, outside the building, to get the important work that needs to get done completed. So I just thank you for the opportunity to participate in this phone call. And,
Yeah, thanks so much, John. I really appreciate the conversation. I think this has been really helpful, for me to help, frame some of these issues. And it's been, I know that the people who are watching this, I'm sure will appreciate it. So for those of you who want to find out more about me, you can go to votesteveowens.com. It's my website. If you found this via Facebook, then you know what my Facebook page is. If you want to follow me on Twitter, it's also Vote Steve Owens. You want to volunteer, we are looking for, thanks to COVID, we are not doing door knocking. We don't want to be the campaign that spreads it around to our neighbors. So we will be doing, phone banking and mailing and things like that. So any help that you can do on that will be very much appreciated. Again, I want to thank Jon for coming in. You've been a good friend for a long time. I think the first time we met was at a Democratic state convention. I think you were whipping the floor for the
Yeah.
state party or something like that. And
I remember that. Yeah.
and
You were helpful and kind of like, yeah, no, I remember that. I think it was trying to whip the floor, and you were helpful in finding out who's who and that sort of
right.
thing.
Yeah,
Yeah.
I was playing goalie for you, making sure that we could figure out who all the activists and the delegates were.
Exactly. Yeah.
We're an unruly bunch, but we're mostly friendly. So thank you so much. I really appreciate it. Thank you everybody who's watching this both online and on the Facebook page. We will be posting this to YouTube as well. I think we're going to start doing recaps of these events for people who might not have the 45 minutes to sit through. As exciting as I am to listen to. The secret to being exciting is to invite exciting people on. So so thanks again, Representative, and I will we'll see you on September 1st.
Great. We'll see you guys.
Take care.
Thanks, Steve.
Let me